Hello community, Dr. Art Bettman here. I'm here with Sarah, who's a very special member of our practice. Sarah and I have been working together for well over 10 years, and Sarah's agreed to tell her story and experience as a patient in our office. So Sarah, what originally brought you to upper cervical care back in the day?
What brought me, well, first of all, thank you so much for having me here. I feel so honored. I love the treatment you offer, and that's why I have been coming here for 10 years. I came first and foremost because I have Meniere's disease, and I was diagnosed with that when I was 21, and I'm 49 now, so as you can imagine, that's a really long time. So when I came here, my husband actually had found you online, and it said on your website that you treat people who have Meniere's disease. So that's where I came first for that. But then what happened was I found that a back condition that I have called Brulati syndrome is the treatment that you offer, that you give, and everyone else, that all the other doctors that work here. I need to come here every 2 weeks to maintain a feeling, just feeling balanced. And it's helped me to, it's changed my life. Like not just treating the Meniere's and my back condition, it's just opened up a decade-long journey in recovery as a woman, as a whole in many different areas. So it really was just the launching pad upon which I, started a brand new life of health and wellness.
Awesome. So there are really two conditions, the Meniere's and also this lumbar condition, for those who don't know what Brulati's is. And how are those two conditions affecting your day-to-day life? Like what were your limitations? What were you being held back from doing?
Well, before I started, I was very depressed. I was in a lot of pain because of my back condition. I was going to a chiropractor, like the jump on your back chiropractor, and I was not getting much help with treating my Meniere's disease. It's a vestibular disorder that impacts the inner ear and causes balance issues, extreme fatigue, anxiety, hearing loss, and is progressive. And I had terrible coping skills. I was at a point in my life where I was using alcohol as a way to numb myself physically and emotionally and mentally. And I also had untreated depression and anxiety. So I was a whole bag of worms, not knowingly, when I first came here. So really, like I said before, I was just a complete and utter mess, and I was in the process of being and I still am a stay-at-home mom with three, at the time, young boys, 2 of whom have autism, and now they're teenagers, and one's in college. And so that's how I came here, and today my life is completely different.
Well, first of all, thank you for being so open and vulnerable. I mean, I think it's important because people don't just come with a pain syndrome, they come with emotional health and mental health, and lots of times those two go hand in hand. When one's not right, the other's not right. And so chiropractic can serve not only on the physical side, but the mental, emotional side as well, and helping support that person. So life is better now. So tell us about life now. What are you doing? What are you able to do? What does it look like for you?
My life is wonderful. I came here feeling like I was 89 years old. Today, I feel like I'm 30. And even though I may not look 30, I feel it inside. I have much more energy. I exercise. I lift. I do these amazing classes at the YMCA where I live, and it's a lot of strength training. And I do yoga. And so like inner peace, outer strength, and I have a much better, my husband and I, we have a much better diet than we used to have. We eat non-GMO foods, organic, and no sugars, although we do have non-dairy ice cream every now and again.
We won't tell anybody, we just told everybody.
And I just have so much more energy, and I have a much more positive outlook in life because I felt like my life was ending when I came here, and now I feel like my life is just getting on its way, and I just feel better. But the healthier I feel physically, and the more comfortable I feel physically, it impacts how well I sleep. It helps my anxiety and depression, and it also helps me just, I have more joy just because I feel so much better, and so I want to do better. I've started my own business now. It's a health and wellness business called Living in Balance. I have a podcast to help people who are struggling with alcohol, and I get to be of service to people because I've fixed, with your help, my body, and which subsequently has helped my mind, my spiritual health, my mental health, and emotional health. So
it's such a beautiful story, and I'm so happy that it impacted your life the way it did. So many patients will enter into a healthcare office for relief of a problem, for sort of like this treatment model. They come in with a diagnosis, and what's beautiful about chiropractic care, it ends up being a springboard to this wellness lifestyle where you came in for a specific problem but stayed for wellness. And we say that fitness never has a finish line. We're always working on ourselves. We're always looking to improve ourselves. What would you say to the person that's looking at upper cervical care for the very first time? Maybe they're nervous, scared, or skeptical. What would you tell them about the care? What would your recommendations be?
I would say if you're not feeling good, if you're uncomfortable and you want to feel better, and you want to feel better forever, come here. Come to this practice. Dr. Arbeitman, when I first came here, I was really scared. Like I said, I was in a very different place emotionally, mentally, physically. I felt 50 years older than I actually was, and Dr. Arbeit, you were so compassionate and you were so caring, and I was in a lot of pain. I was not right, but you took time, and you were always asking questions and making sure that I was comfortable, and you worked on, you trusted me when I told you how I felt, and that impacted how you cared for me, and now I trust everyone in your practice as you've grown this past decade. And so I guess what I'm saying is that here you can find wellness if you want to feel better, if you're willing to really put yourself first, you're here for a reason on this earth, and I believe firmly that I wasn't put on this earth to feel uncomfortable all the time, and there are ways today where we can feel better, and coming every 2 weeks is my recipe for comfortability. If I miss a week or into a month, I definitely feel it, and I travel 45 minutes to get here every 2 weeks, and that's how much this kind of care has helped me and continues to help me. So I don't plan to stop anytime soon.
Well, I'm certainly proud of you and the growth that I've seen in your health and your lifestyle. And I'm so grateful that you've trusted our whole team to take care of you all these years, and the best is yet to come.
Thank you.